Addiction and overdoses are affecting every corner of our state. Oregon saw a threefold increase in opioid overdose deaths in a recent 2-year span. The controversial law Measure 110 was put in place to help people access recovery service, but it also decriminalized certain amounts of hard drugs. Blair Best joins us in the newsroom. And Blair, a report was just released on how the program has been doing.
Joe, the early data shows that Measure 110 is making an immediate impact for people struggling with substance abuse across the state. That's everything from housing, access to treatment, and increasing outreach staff. However, some lawmakers are still skeptical of the program, and regardless of this data, are threatening to cut back on its funding. In a preliminary report released last week, the Oregon Health Authority found more than 60,000 Oregonians struggling with addiction were helped through Measure 110. That's the Drug Addiction Treatment and Recovery Act voters approved in 2020.
This is really expanding a workforce that is critical and was kind of previously very underfunded.
Measure 110 decriminalized user amounts of hard drugs and redirected tax dollars from marijuana sales to pay for addiction recovery centers and grants. The report shows in the first 3 months of the program, Measure 110 providers helped more than 18,000 people, primarily in rural areas of the state. And later, through the Access to Care grants, another 42,000 people received treatment and temporary housing. About $3 million went toward hiring employees.
We know that Access to Care created over 200 new jobs and staff training for roles such as peer support specialists, certified recovery mentors.
Overall, $265 million was given to 42 recovery groups and 11 tribal partners, reaching every county in the state.
A sobering center in Southern Oregon reported that they had eased the local emergency room burden and served as a stepping stone to residential treatment and detox services.
Less than 24 hours after the data was released, the House Revenue Committee held a public hearing where they talked of cutting funding for Measure 110, as much as $60 million, a recommendation that's at odds with Governor Tina Kotek's proposed budget she released last week.
Investing in substance use treatment and services. Addressing gaps in treatment by providing startup costs for residential detox and inpatient treatment.
Many argue parts of Measure 110, like decriminalizing certain amounts of hard drugs, is making the addiction crisis worse, and access to treatment isn't expanding fast enough, leaving people like David Castle,
and that's where I shut up just a while ago,
who's addicted to heroin and homeless in the Dalles.
A lot of people just die on the streets because that's the only way there is.
Falling through the cracks.
If there's no detox here, the hospital won't do nothing for you. They'll give you a shot and send you back out on the streets.
Do you think Measure 110 has made it easier for you to stay on the street and stay addicted?
Oh, yeah. When you don't get in trouble for using drugs? Oh, yeah, a lot easier.
Well, more data around Measure 110 will be released in April. And the next hearing on the bill's funding is on Tuesday. Joe?
Thanks, Blair.